In this chapter, we'll review the most important blood tests. Why do we need those? Just like physiological measurements, blood tests add to the picture from a different viewpoint. They aren't better or worse than physiological measurements, they just supplement our analysis of our progress. For example, let's say that Mary has dropped 10 kilograms or 22 pounds because her doctor told her to do that due to rising cholesterol. So Mary did this as best as she could. But instead of cholesterol getting better, it got even worse. This tells us that Mary has lost most of the weight from muscle and water mass, and that her metabolism has only worsened, even though she would be very proud to have dropped that weight. This is why we can't ever count on only one measurement, but different ones in combination. So let's go over the most important blood tests. Blood sugar self-monitoring, mandatory for people with blood sugar metabolism impairment. It is by far the best measurement for how blood sugar actually reacts in everyday life, not just random laboratory tests once a year. The standard method is 3 to 5 days when blood sugar is taken after fasting, and then before every bigger meal, and 1.5 through 2 hours after. This gives us a complete picture of how blood sugar levels behave. For blood sugar goals, refer to the attached table of normal and pathological levels. The next section is about laboratory blood tests and should be taken at least once a year for people with medication, illnesses, or impairment in metabolism, and about every 3 years for healthy adults. Your doctor will plan individually how often you should go take the test, but these are just for references. HbA1c, or long-term blood sugar. This is a good way to test the average blood sugar levels of the past 2 to 3 months. It should be taken at least once a year for people with high risk for diabetes or people with impaired blood sugar metabolism. Full blood count. We can see the hemoglobin levels and red blood cell measurements, from which we can get indirect clues about iron deficiency and some other things. Reference values differ, as there is no ideal range. Sodium, potassium, and serum creatinine, also known as body's hydration level markers. Sodium and potassium are 2 main electrolytes in the blood, and creatinine is a protein metabolism end product that gets secreted into the urine by the kidneys. Those can give a good idea of kidney function and hydration. Reference values differ. There is no ideal range. ALT, or alanine aminotransferase, and other liver enzymes. Liver enzymes rise in many different acute situations, like some medication and gastroenteritis. Chronic mild rise often refers to fatty liver and is a good marker for overall visceral fat levels. Many other things can cause this. That's why it needs to be analyzed in context. Alcohol overconsumption being the obvious reason, ideally 10 through 30 UI range. Lipids, LDL, HDL, triglycerides, the common blood lipid panel. Usually used as a cardiovascular risk assessment, but it works much better as a part of an overall metabolism assessment. One single test is never enough to assess one's cardiovascular risk. There are different formulas used to analyze lipid profiles. For example, LDL or HDL, and the closer one is to 1, the better. Triglycerides are below 1 millimole in a healthy body. HSCRP, sensitive C-reactive protein, this is the inflammation marker, which is the best measurement for low-grade inflammation. The problem is that it is very sensitive to many different things. That's why 1 to 2 high measurements don't automatically mean low-grade inflammation. It should be below 1 mgl, above that points to low-grade inflammation. Vitamin D, one of the most important vitamins for metabolism, and is below optimal for most people here in the north. Should be 100 nanomoles or above. Those were the must-haves for metabolism evaluation, but many more blood tests can give us an even wider picture. For example, thyroid hormones, different vitamins and mineral levels, hormones like insulin, cortisol, and others. All those require a competent doctor to analyze correctly. Just looking for reference values doesn't give us much information. There is a lot to know about laboratory tests. They don't learn to be doctors for 10 years for no reason. But there's no need for you to know everything. If you know the basics, then it is better than 99% of people.